Welcome to Better Health Guy Blogcasts, empowering your better health. And now, here's Scott, your Better Health Guy. The content of this show is for informational purposes only and is not intended to diagnose, treat, or cure any illness or medical condition. Nothing in today's discussion is meant to serve as medical advice or as information to facilitate self-treatment. As always, please discuss any potential health-related decisions with your own personal medical authority.
Hello, everyone, and welcome to episode 221 of the Better Health Guy blogcast series. Today's guest is Dr. Alan Bauman, and the topic of the show is getting to the roots of hair loss. Dr. Alan Bauman is an acclaimed board-certified hair restoration physician with nearly 30 years of experience in the medical field. He's the founder and CEO of Bauman Medical, an international leading treatment center in the field of hair restoration. Dr. Bauman received his medical doctor degree from New York Medical College in Valhalla, New York, and underwent internship and residency training in surgery at Beth Israel Medical Center and Mount Sinai Medical Center in Manhattan before dedicating his expertise to the specialized fields of hair transplant surgery and the treatment of hair loss. With a particular focus on androgenetic alopecia or hereditary male or female pattern hair loss, Dr. Bauman has established himself as an authority in the industry. He has treated over 34,000 patients, performed over 12,000 hair transplant surgeries, and administered over 12,000 PRP hair regrowth treatments. He is a frequently invited faculty member and guest expert at numerous international scientific meetings and live surgery workshops, and has been featured in hundreds of news stories in the media. Dr. Bauman is one of approximately only 200 physicians worldwide to achieve the certification from the esteemed American Board of Hair Restoration Surgery. He was voted #1 top hair restoration surgeon in North America by Aesthetic Everything for the 7th consecutive year, top hair restoration surgeon of the decade, and received the 2022 Lifetime Achievement Award in hair restoration. He was also recognized by Forbes as one of 10 CEOs transforming healthcare in America and included in the ApeToGentlemen's list of the world's best hair transplant doctors for 4 years straight. And now my interview with Dr. Alan Bauman. Today, we're going to learn from the world's leading authority and get to the roots of hair loss, a condition which impacts many dealing with complex chronic illness and really goes more than just skin deep, as it can really impact our self-esteem, our confidence, and how we navigate in the world. Thanks so much for being here, Dr. Bauman.
Hey, Scott, thank you so much for having me. It's really a pleasure.
What was it that got you interested in the world of hair loss? Did you have a personal experience that drove your passion for the work that you do today?
So I never thought going into the world of medicine, specifically surgery and plastic surgery, that I'd end up being a hair transplant surgeon. I mean, that was kind of not on my radar at the early stages. I was mentored by a plastic surgeon really before I could drive a car, and he introduced me to the world of cosmetic procedures and treatments. And remember, this is in the 1980s, so you couldn't go on YouTube, you couldn't look on Snapchat. There were really, even on Discovery Channel, there wasn't anything about what happens behind those surgery doors. So I had this really unique opportunity to watch surgery through a close friend of the family, and also to see his patients transformed, not just by the amazing techniques and artistry in the OR, but of course, on the back end, seeing them so happy and their quality of life improved because of the work that he did, whether it to be repair form or function. Either way, patients' lives were changed. And that kind of got me excited. Even dialing back further, I guess, people say, well, how did I get involved in medicine and interested in medical school? And I guess if you asked my grandmother when she was alive, she would have said something like, when it comes to Alan thinking about going to medical school, it probably would date back to the day he was born. So it was kind of preordained that I was going into the field of medicine, and then that exposure to surgery kind of led me through the path. And I always had this opportunity when I was off from school, during a break, or even home from college, to watch surgery. But it didn't have anything to do with hair. Of coincidentally, maybe not, at the same time, my dad was losing his hair and he was dealing with a comb over and eventually got into a hairpiece situation after toying around with some topicals and things like that. And so I always kind of knew in the back of my mind, just on a separate note, that maybe my hair would be at risk. I was hoping that I wouldn't end up looking like my grandfather, who had no hair from the time that I can ever remember, my dad, who lost his hair when I was in high school, essentially, and ended up in a hairpiece. And my mom's dad also who had some significant hair loss. So I guess I always just kind of thought maybe it would happen to me. But really, my life journey kind of changed a little bit after I was in my internship and residency in medical school. After medical school, I should say, internship and residency in general surgery, I met a patient who had a hair transplant. And he was undergoing some other procedure, and I was being, the good resident, getting the medical history and all of that business. And it had come out that he had a hair transplant. And I couldn't tell that he had a hair transplant. And in the 1990s, I felt that was something very unusual. I expected his hair transplant to look pluggy and ridiculous and because I had this preconception, why would you ever do a hair transplant? It looked so nasty. All I had seen were plugs, essentially, the old style, kind of punch graft style hair transplants. And so we got to chatting briefly about his hair transplant and where he had it done and how he chose the doctor and some of the techniques involved. Just from a layman's point of view, he's like, well, he was so excited, first of all, that I couldn't tell that it was a hair transplant. But he was explaining single follicle implantation, and I'm kind of looking at it from a social distance. I'm like, wow, it looks amazing. He's like, thank you so much. It's amazing. It's been great. And so I kind of got the idea that the technology had changed a little bit without me being aware of it. Not being a dermatologist, not being ever seen a hair transplant before, except that one time, just seeing it up close. After it had grown in, I was like, wow. And then the other thing that struck me about that conversation was how he told me that his life was never the same afterwards, that his life was totally different. It changed the course of his career. It changed the course of his life socially. He became engaged and married and has kids and, the CEO of this corporation and all these different things that happened. And he says the hair restoration was the pivotal moment when he got back, just his mojo, his confidence. And so I started to think about it for a minute. I'm like, well, maybe I should look into this thing and see what's going on. And from there, the journey became the path less traveled. And through some encouragement from my mentor, who was the plastic surgeon, said, yeah, go check it out, see what it's like. And so I ended up going to different conferences, reading textbooks and journals, looking at the latest and greatest, because the textbooks were old. The journals were a little bit more up to speed, but going to the conferences, I was really seeing the latest and greatest. And I was like, this is really microsurgical and artistic, and I want to learn more about it. And eventually I came across a physician who invited me in as a fellow, actually. And I trained under this second mentor of mine, a hair transplant surgeon out in Long Island, who taught me the ropes, essentially. And that's where I cut my teeth in hair transplants. And I figured I would just learn a little bit, about the process and then go back to my regular routine of plastic surgery training. And it really changed the course of everything. I realized that if I was going to be good at hair transplantation, I needed to focus on it because it was becoming a very labor intensive and very intricate and artistic process. And so that's where I kind of, made this deviation from that plastic surgery world, specifically into what I consider the specialty of hair restoration. The board certification had just been born, maybe around that time. So it was really coming together as a unique and standalone, although orphaned, specialty. And what I mean by that is that there's no direct path from derm or general surgery or whatever into hair transplants. It's out there by itself, and you have to kind of jump from one pond into another pond, if you catch my analogy, to find out what it's all about.
And it's great that you still have good hair. I'm always a little skeptical when you see people promoting hair loss solutions, but they have absolutely no hair, right? It's a little.
Well, thank you so much. It's a testament to fighting like hell every day, to be honest, because, with the genetics not on my side, and I've done the genetic testing, I know what my family tree looks like. I've seen my grandparents and my dad and all of that with their severe hair loss. I've been on treatment for decades, honestly. And so it's not without a fight. And so I guess that's probably the most important take-home message, just to start off with that, is that if you want to preserve your hair, keep your hair, then time is follicles. And that's what we say, time equals follicles, because if you delay treatment, then you're going to need a lot more aggressive and invasive interventions than if you start with non-invasive therapies early on. And so I still probably need a little hair transplant, maybe for the spot right here. And my crown is about, 50%, almost 60% depleted. So eventually I'll need some work done, but I fight like hell. Like I said, medications and lasers and not regenerative treatments and things like that all the time and consistently.
It also strikes me that you've been doing this for quite a while, and I can tell that you're still very passionate, very excited about what's coming next in this realm. And so it's great to see that that still excites you. Let's talk a little bit about kind of just setting the stage initially for people listening about hair growth and hair loss, the different phases when we think about anagen, catagen, telogen. And then I've heard some people also talk about an exogen phase. So when we're thinking about ways to improve hair growth and minimize hair loss, is the focus more on increasing anagen or growth or on decreasing the loss phases, or are we trying to do both at the same time?
Yeah, it's really a combination approach. And so what you've talked about, anagen, catagen, telogen, are the natural growth cycles of hair. Hair follicles are like the production manufacturers of that hair fiber that we see growing out of our scalp and, of course, other places on our body. So, but think about the follicle as a 3D printer. It makes that long, thin, keratinized strand of dead protein. And that's a beautiful hair strand. That's what we want that follicle to produce on and on. But even naturally, even if you have 150,000 hair follicles on your scalp at any given time, about 15% of them are in a resting phase, meaning that they're turned off, and that they're in a degeneration or regeneration phase. And so that's the catagen and telogen. And then the cycle begins again. And that's all under normal circumstances, that hair follicles will spend about 5 to 7 years on average, sometimes more, growing a hair, and then about a 90-day cycle to kind of reboot, degenerate, regenerate, and grow a new hair. And somewhere between one cycle and the next, and that resting phase and the new growing phase, the old hair exits. And so every single day, hair follicles turn on and turn off. And when you shower, shampoo, brush your hair, or even just run your fingers through your head of hair, you're going to see some shedding every day. And that's normal. About 50 to even up to 200 hairs per day can be considered normal shedding. Now, of course, if it's accompanied by a decrease in coverage, or if it's a severe shedding situation, you're not replacing enough hair, that could be a sign or symptom that something is going wrong. And for example, if a women come in and they put if you wear a ponytail in your head literally for a week, when you take that ponytail out after a week, you could have 1,000 hairs come out of your head, and that would still be okay because that's the normal shedding. But there are definitely a lot of things that can dysregulate the hair follicle function. Hair follicle is a very highly metabolic cell population. The root of the hair, the proliferating progenitor cells in the dermal papilla, is what's duplicating at rapid speed, creating those strands of hair. And so a lot of things can affect that production. Everything from nutrients and fuel. If you're caloric restricted, you're not going to grow good quality hair. The hair quality is going to be poor, or the follicles could actually shut down if you're in a starvation mode. And so we see this in poor diet, restrictive diets, people who don't absorb protein very well, or they're eating different types of protein for vegan or vegetarian reasons, or they're on a weight loss program where caloric restriction is part of that program, or even doing rapid cycles of fasting. You can throw a lot of hairs into that shedding phase. And then whole body inflammation is a big issue, or even scalp inflammation can shut down those hair follicles. So the way that you treat the skin of your scalp, creating an environment that may or may not be good for quality hair growth. But so many things, from hormones to your lifestyle factors to sleep-awake cycles to, as we said, nutrition and so forth, stress and cortisol can all affect the hair follicle function. But usually there's some underlying tendency genetically towards male or female pattern hair loss, or some autoimmune tendency as well. So the treatments that we are designing to help each individual patient is just that, very unique for each individual patient, depending on their diagnosis, what their symptoms are, how their scalp health is, their lifestyle factors, medications or illnesses that may be surrounding the situation. And then, of course, dealing with the genetics and so forth to try to stimulate better hair, tell those follicles not to turn off, provide good nutrients and fuel and a great environment for hair growth. And that's probably why hair is so important generally, psychologically, because it's an outward sign of so many components to our overall health. Some that we may have control over and some that we may not, but it is an important sign, and also a sign of age and fertility or not.
So we're going to dig more deeply into a lot of those things that you just talked about. But wondering, let's talk a little bit about the different types of hair loss that people experience. So if we think about more androgenic or hormonally driven, telogen effluvium, alopecia areata, traction alopecia, and are there certain types that are more common in men versus women? And then maybe what percentage of men and women deal with some degree of hair loss in their lifetime?
Yeah, so hair loss is a pervasive problem throughout, even in just the United States alone, more than 80 million men and women are dealing with a hair loss situation. And I honestly believe that number is undercounting other hair problems such as hair quality and texture and so forth. I've certainly seen a lot more patients come in at a lot younger age than ever before in the practice. So I have this sense overall that number is much higher than what for example, American Academy of Dermatology says, or even the American Hair Loss Association says. If in my practice, it's almost 50-50. It's about 60-40 men to female. And that pretty much tells you what's out there in the general public in terms of hair loss problems. Now, most of what we see in the practice is genetic in nature. And in men, we know androgenetic alopecia, as you mentioned, is a genetic situation where you're sensitive to your body's hormones. The male androgens, specifically DHT, dihydrotestosterone, triggers this gradual and progressive miniaturization. And in some cases, it doesn't seem so gradual. It seems kind of sudden often. Guys as soon as puberty has ended, sometimes hair loss can begin. But 20% of guys in their 20s, 30% of guys in their 30s, 40% of guys in their 40s, and so forth are going to be experiencing some signs, visible signs of male pattern hair loss. And that means that in those areas where you can see more scalp shining through, whether it's a receding hairline or thinning in the crown, you've lost over 50% of the density in that area. So a lot of hair loss has to happen before it's noticeable to the naked eye, which again goes back to the time equals follicles statement that I made earlier on. But that's really the primary thing that we see. Other causes that you mentioned, and I should say hereditary hair loss is also a primary cause in female pattern hair loss, which is also called androgenetic alopecia, by the way. But what I find is that our women are more sensitive to the other things that we mentioned. So nutrition, inflammation, stress, hormone imbalance, all of these different things can dysregulate the hair follicle function. And it just seems like female hair is more sensitive to all of that, maybe than the male counterparts. Alopecia areata is an autoimmune condition, and that looks different than just a receding hairline or thinning in the crown for men, or the female version of that, which is some diffuse thinning in the frontal zone, maybe a widening part line or a little bit of a receding hairline later on. Alopecia areata, it usually starts with a round circular zone where the follicles lose their immune privilege. And what that means is that the body attacks that area and the follicles shut down. The good news is that sometimes it's just temporary. It could be triggered by stress or an allergic reaction to something in the environment or something you ate. And sometimes it just resolves on its own. We like to use different types of treatments for alopecia areata than what we would use for male and female pattern hair loss. It's mainly, the treatments are mainly designed to blunt that inflammatory effect. It could be medication like an injection or a PRP injection, for example, whereas a male and female pattern hair loss, we're going to be using other modalities initially to get the job done. The other condition you mentioned, traction alopecia, is quite common in men and women who put tight braids or are wearing tighter hairstyles. We see it in African American populations where the braiding is right along the skin oftentimes, or dreadlocks where we have a lot of weight on the hair fiber itself pulling on the follicle over time. Women with extensions, men with wigs or weaves, and women with wigs or weaves. So anything that puts extra tension or tightness or traction on the hair is going to pull on the hair follicle, and that can cause a degradation of hair quality over time. So interrupting those hair follicles. Those are some of the main things that we treat. We do treat a lot of scarring alopecia also in the practice. And scarring alopecia is where the follicles are replaced with a scar tissue. Now, it could be from a trauma, like a burn or an injury, let's say, to the scalp, or it could be caused from a chemical burn, something that you're placing on your scalp over time. Women that do extensive perming or coloring can actually, over time, degrade their scalp and basically turn the scalp into scar tissue slowly but surely. It's almost like death by 1,000 cuts each time you have exposure to that harsh chemical. You get a weakening effect of the hair and eventually a balding effect in some of those zones. So scarring alopecias can be severe. We also see frontal fibrosing alopecia, which is a type of scarring alopecia where the hairline is just eroded completely, mainly in our women that are 45 to 65. And we see a complete loss of hair. The skin turns white and thin. You can see the veins sticking through. And that's a reaction usually to something that they've had applied to their scalp, for example, like moisturizers, sunscreens, nanoparticles, things like that. And that's a very difficult condition to treat. Although if we can get it to burn out or resolve, we can sometimes transplant that successfully. So there's an important take-home message there. Is we've talked about all these different types of alopecia, which is just general term for hair loss. Before you start any therapy or treatment, it's important to know what you're treating and where, and get a baseline measurement. That's a really critical step also, often overlooked.
So we're going to talk more about a number of different causes, the hormonal imbalances, the nutritional deficiencies, that autoimmunity, inflammation that you mentioned, stress or emotional triggers. We're also going to touch on environmental toxicity, infections, medications, so many different things. But let's start with kind of the hormonal conversation. I would say one of the things that you more commonly hear is the DHT, and that excess DHT in the hair follicle is one of the more commonly accepted causes, though you occasionally see people that say, oh, it has nothing to do with hair loss. One of the things that happens is as you increase testosterone, and sometimes I've seen this with people that have done testosterone replacement, that DHT also increases. And so they potentially then start losing hair as they're introducing exogenous testosterone. We know that reducing DHT can help to minimize hair loss, but I'm wondering if there's a downside of reducing DHT too much, meaning does it have any beneficial role in the body where reducing it to a point that it's excessively low could be trading one problem for another?
Well, lots to unpack there for sure. It's probably not necessarily the level of DHT that's the problem for some patients, because as you know, there are some folks out there that can boost their testosterone and have no impact on their hair whatsoever, meaning that their hair follicles are almost immune to DHT. So what we inherit is the sensitivity to DHT. That's what's different between someone, it could be brothers, one that has early male pattern hair loss and the other may never see male pattern hair loss. What the difference is between those two folks are the sensitivity to the DHT, most likely. Now, and how do we know like that DHT is the thing, right? Well, guess what? There's a drug that lowers DHT levels pretty significantly. And actually, there's two that do that pretty well. And we know that if you take guys who have male pattern hair loss and you decrease their DHT by about 60 to 70%, about 90% of those people get a positive response from taking that medication. So that medication is finasteride. It blocks the conversion of testosterone into DHT by targeting the enzyme. So DHT levels drop, as I mentioned, a little bit. Maybe not all the way, but 60 to 70% lower. And 9 out of 10 guys look the same or better in the long run. And 2 out of 3 get some regrowth from doing that treatment. So for sure, we know that DHT can be an issue. And as you mentioned, if you're sensitive to DHT and you're in that age category where you need some hormone optimization, men or women, then if you increase that testosterone exogenously, as you mentioned, more is going to turn into DHT, and you could accelerate your natural male or female pattern hair loss problem. And this is very common in my practice. We see hormone optimization patients routinely who, not to say that they've been overtreated, but for them, maybe that was the thing. They got, hormone pellets. A woman who was very sensitive to DHT, she got pelleted, and within 8 to 12 weeks, she had a massive recession of her frontal hairline, and to the point where she needed a hair transplant to fix it. We could not reverse it with just standard medical therapies alone. So we know that DHT is a trigger. I mentioned finasteride lowers it down 60 to 70% with the success rate of 90% in our men. We know dutasteride is the other drug that blocks both pathways to DHT, the type 1 and type 2 5-alpha reductase pathway, and that lowers the DHT down probably 95% down from the normal levels. And that has a much stronger effect on the hair regrowth, but also could increase side effects. So you mentioned you mentioned some issues. What are the issues of lowering DHT? Well, clinical trials were done, thousands of patients, double-blind randomized trials, hundreds of questions about their lifestyle and everything from their sleep-wake cycles to their sexual functioning, libido, and all the other things that you can possibly imagine. And we know that 2% of patients on finasteride have complaints or concerns about decreased libido, so mild and temporary decrease of sex drive, or mild and temporary erectile dysfunction, meaning that they have difficulty maintaining a hard erection. The good news is that if they had those side effects, they could stop the drug, the medication comes out of their system in a week, and they're back to normal. And I know you're going to probably get all kinds of calls and DMs and everything else on what about this post-finasteride syndrome and this, that, and the other thing. And yes, there are people out there with sexual dysfunction that may or may not be related to the drug finasteride. Many of those folks have been investigated, if you will, and it turns out that there's other toxin exposure, drug use, and things like that that could also be decreasing their libido and sex drive. So what we do know is that there are now other clinical trials, published studies in the literature that support the fact that the medication comes out of your system, and all else being equal, that you're going to regain function and desire and all of that if you're one of those unlucky 2% of folks who have a DHT-mediated sex drive or DHT-mediated sexual function. The side effects are a little bit higher in the dutasteride category. It goes up to 4%. And just be aware that many patients dropped out of the original clinical trials due to sexual dysfunction who were in the placebo arm of the trial. In fact, more people in the placebo arm stopped in the clinical trial than people who are actually on the drug due to sexual side effects. So maybe that tells you something a little bit about, answering these questionnaires and the nocebo effect of what these things could have.
So I know with finasteride and dutasteride, there's warnings about women not touching the pills and issues with birth defects and other things. Is there ever a scenario where we would use either of these medications in a woman with hair loss that had elevated levels or sensitivity to DHT?
Yeah, well, that's a great question. And it sounds so scary, right? Because, women are talking to their husbands about being on finasteride, and it sounds so scary. Obviously, DHT is important when you're developing male fetus in the womb. DHT is the molecule that makes men look like men, essentially, just to keep it super simple. So there is a theoretical risk that if the woman was taking finasteride while pregnant with a male fetus, that there could be a birth defect. That's never happened, never been documented, but it is a theoretical risk. And that's why you'll see that in the FDA warnings. But what we do know is that women who are beyond the years of childbearing age, entering into menopause, perimenopause and menopause, sometimes become androgen dominant. And because of that, we see aggressive female pattern hair loss take effect. In fact, that's the most common time that women complain about changes in their hair: color, quality, texture, volume, density, ponytail volume, you name it. All those complaints happen most of the time, not always, but most of the time around menopause when the hormone levels are shifting and changing. And what we do know from some of the clinical trials is that if you just blindly treated women in menopause with finasteride, about 50% of them do have a successful treatment. They do get some improvement. So there may be something to it. And so over the years, I can tell you personally, having treated tens of thousands of people, that women who are postmenopausal can oftentimes get a positive effect from finasteride. And especially if they're on testosterone replacement therapy, we work to block that testosterone or DHT effect by targeting the enzyme.
Is some of the reason that women lose hair around menopause also related to a loss of estrogen? Is there potentially some benefit in bioidentical hormone replacement therapy for increasing estrogen? And then coming back to the testosterone DHT conversation, do you see hair loss in women with PCOS or polycystic ovarian syndrome?
Yeah, 100%. So again, there is for sure a relationship between the female hormones and hair growth. I wish I could tell you that we have a magic bullet for that, like, oh, just replace the estrogen and progesterone, you're going to be fine. No, but here's what we do know. I mean, obviously during pregnancy, those female hormones are at very, very high levels. And we know that the hair follicle is responding, growing a thicker, stronger, healthier hair. Fewer follicles are entering into that catagen telogen phase. More are percentage-wise are staying in the anagen phase. And most women, not every single one, but most will notice this improvement in their hair during that time. And then when the hormones crash back down to normal, the day after childbirth, actually, 6 weeks later, you can see a significant shed as those anagen telogen ratios go back to normal. And that's oftentimes the first sign that her hair is hormonally sensitive. And so probably deserves some monitoring, obviously, because maybe that's just foretelling what could happen in and around perimenopause and menopause when it comes to hair. So the other factor that you asked about, so again, we don't have like an estrogen progesterone treatment for that, although some of those things have appeared in the literature. I wouldn't say that that's routine. You should discuss that with your doctor. I would never dissuade a woman from hormone optimization therapy. And as you know, even the powers that be are taking away some of those falsified warnings that were created years ago in that world of hormone replacement therapy. So it's more and more women are going to be on hormone optimization, which is great because that's going to be beautiful for longevity and wellness. The other thing that you mentioned was PCOS, polycystic ovarian syndrome, sometimes accompanied by cystic ovaries and sometimes not. It's really a constellation of symptoms like weight gain, hirsutism, which is extra hair growth, oily scalp, hair loss, which really tells me that there's probably some androgen dominant thing happening in those women. And oftentimes we find that when we put those women on a birth control program, double birth control and finasteride or dutasteride, we get some improvements in their hair along with the combination of therapies. So I would say yes, that there is some hope for those PCOS-like or PCOS documented women in terms of their hair growth. But obviously they may have issues with fertility even during PCOS. And PCOS actually, interestingly, is the most common hormone abnormality in women of childbearing age. So there's a huge number of women out there dealing with PCOS, and hair loss is a strong component of that. So I think it's important to know that there is hope for those women out there if we can try to manage maybe the inflammation that's triggering the PCOS. And I'm going to leave that to the experts, figuring that part of it out, from a functional medicine point of view. Getting that inflammation down, figuring out why that syndrome is happening is still, to me, unknown. But I know that on the back end, we can treat the hair loss situation that's occurring.
How much of hair loss is genetic compared to epigenetic or environmental influences or nutrition, hormones? In other words, you talked a little bit about how it's not so much the level of DHT, but the sensitivity to DHT. Is there anything we can do to reduce our sensitivity to DHT? And then really interested in if there is a genetic contributor, how much control do we really have over hair loss?
Yeah, so I think there's a complicated answer to that yes, it's both genetic and epigenetic, and you can't take one away from the other. We know that because we see young men with early male pattern hair loss, so you would say, oh, it's all genetic component, DHT triggered or sensitivity at the level of the hair follicle. But then we uncover that there's other things going on, that they've got toxin exposure, they've been vaping some nasty stuff, they've got poor sleep cycles, their nutrition is fast food and all these other things, and their stress level is off the charts, obviously, because they're not sleeping. So all of these things are accelerating the hair loss situation. And we see that all the time. Thankfully, I think my population has gotten healthier over the years as information is out there on the internet about health and wellness and taking better care of oneself. But I think we started off our conversation about female hair loss, knowing that, yes, there's some genetic component, like look at your family history, look at your family tree, but also take into consideration that nutrition and the diet and those other factors, lifestyle, inflammation, scalp health, often overlooked problem that could lead to a lot of thinning and breakage. You wouldn't even know it until you get a microscope onto the scalp and see what's going on there. So I think it's there's no one rule like, oh, it's 80% genetic and 20% epigenetic. I think it can vary because oftentimes you just put the simple DHT inhibitor with a little bit of, hair growth stimulator like a minoxidil, and it's a miracle cure, but not always. Right. So why does that one treatment not the same for every single person, or male pattern hair loss or female pattern hair loss in postmenopausal women? And maybe it's due to our genetic variations. And just to lead into the next thing that we do diagnostically is we could take a look at a person's DNA and dissect out different metabolic pathways that may either contribute to their hair loss situation, meaning nutrigenomic deficiencies that they're predisposed to nutritionally, that you should take blood work tests for example, or metabolic pathways that say, well, your type 2 5-alpha reductase is a little bit higher activity than normal, so you're going to actually create more DHT. So there are a variety of different things that can be elucidated. Oh, even resistance to minoxidil. Years ago, we didn't know why 30% of people didn't respond to minoxidil. Today, we know there's a genetic variation that impacts sulfotransferase activity, which is the enzyme in your skin that converts the minoxidil that comes out of the bottle into minoxidil sulfate, the active metabolite. And if your sulfotransferase activity happens to be low, and again, you can check that through DNA testing, then you're not going to get a great response from traditional topical minoxidil. You got to do something a little bit different. There's ways to kind of figure this out. If you've tried traditional therapies and gotten nowhere, then let's take a look at the DNA. Let's take a look at your hair density measurements. Let's take a deeper dive into the functional, holistic, components that, maybe your general practitioner or even your regular skin doctor, dermatologist maybe overlooked, didn't even have time essentially to talk to you about.
So I'm guessing that you're talking about something like the TRICO test, and I'm going to come back and ask you some more questions about that a little bit later for exploring some of those things that maybe will work better for one person or are more of a contributor for others. We know that hair loss can also be related to hypothyroidism, to Hashimoto's, which is an autoimmune condition. So what should we be looking at to assess that condition and really support the thyroid? Do you find that people do better with their hair when they're on T4 or T3, or maybe supporting the thyroid with nutrients like selenium and iodine and tyrosine, those types of things? And then kind of broadening out from the Hashimoto's being an autoimmune conversation, how often is hair loss related to broader systemic autoimmunity? And when you have those patients, are you then looking for the underlying infection or underlying environmental toxin that might be triggering their autoimmunity? Or do you find that tools like maybe low-dose naltrexone can help in modulating that immune response? How do you address the thyroid and also broader autoimmune potential?
Yeah, for sure. Well, a lot to unpack there too, but just to kind of circle back to thyroid hormone, we know that hyper and hypothyroid tends to wreak some havoc on your hair. And so you definitely want to try to get that handled. And of course, my propensity is to do it in a holistic kind of way. And I'm certainly never professed to be a functional endocrinologist, and we do have resources in that regard for folks who are looking to go down those roads. And our blood tests oftentimes will elucidate whether there's some imbalance there, or maybe even just symptoms, right? We can figure out what's going on. There's a thyroid issue. So I would just give you kind of just a basic overview on the thyroid, just to say that if you try to fix the thyroid, you're better off for sure, but it still doesn't get you out of the woods. Because here's the thing, let's just say, your nutritional modification or lifestyle factors or decreasing inflammation improves your thyroid function a bit, but you still have to be on some thyroid supplementation or medication, right? It's not the same as a normal thyroid. It's bouncing around up and down. There's a peak and a trough when you take thyroid medication that you wouldn't typically have, because your thyroid works like as a thermostat typically to keep it even keeled all the way through the day. At least that's what I understand. But when you're taking that medication and it's bouncing around, I'm convinced that probably the hair follicle doesn't love that either. So thyroid is always a risk factor in hair loss, whether you have a thyroid condition or whether you're treating the thyroid condition. You still get that checkbox, like if you're in the no bueno category, that we got to keep an eye on that, and you should chase that down. And again, whether it's a functional nutritionist or whomever, a practitioner can help you kind of dissect through that whole body inflammation, Hashimoto's. If you can figure out the trigger for the Hashimoto's, everything is going to improve better, obviously, rather than just like, pinpointing, oh, you need to be on thyroid, medication. So that would be my concept on that. And then the other question that you had was on autoimmunity in general. And so whole body inflammation is something that we see more commonly now with mold exposure, also Lyme disease. We see a lot of it, even, I would say, even after COVID, whether the COVID infection or COVID vaccinations seem to trigger this kind of dysregulation in the autoimmune system. And just from my own experience in my practice, and we spoke about this off air before we got on the call today, I have patients that we have treated for autoimmune alopecias, alopecia areata, alopecia totalis, and things like that had been in remission for a decade, where they came in, they got some treatments. Maybe we did some PRP in the area. Maybe we did something else, red light therapy or whatever it was, or nutritional modification, got rid of some of those environmental triggers and things like that. And they were just doing great. They never had a recurrence of alopecia areata. And then all of a sudden, during the pandemic, it was like a flood of all these patients that we had not seen, literally hundreds that we hadn't seen in years and years. All of a sudden they came back. I've got a small spot. It's getting bigger. This is the third spot. It's popped up. And, dissecting through all of them, yeah, certainly the stress of a lockdown, masking, or, being in their house, isolated from family and friends, their support group, not being able to exercise on the beach or get to a gym. That's all stressful stuff. That seems like a nightmare, but many of my patients went through that. And then the vaccination effects also. People who were vaccinated all of a sudden came in 6 weeks later. All of a sudden, they've got their autoimmune condition has popped up again. And you can dissect through the research today that a lot of that is now popping back up in the literature, things that were suppressed or maybe not looked at for whatever reason. Now you can find there's a lot of data out there that these mRNA shots, in many cases, not all of them, but in many cases, dysregulated the immune system, much to a patient's detriment. And, your immune system is kind of important for your health and wellness, anti-cancer ability, and all the other good stuff. And then the last thing I would say is that even just the sheer infection, right, of COVID-19, if you were, God forbid, hospitalized, you were fighting a fever, we already knew that you were going to have some massive shed down the road. This was not something that was a surprise to those of us in the hair world, because the Spanish flu was the trigger for the first time. Febrile alopecia appeared in the literature. So when Spanish flu went rampant, what doctors noticed and reported into the clinical literature was severe shedding, and almost to the exact same timeline as COVID infections, basically 6 to 12 weeks after the fever subsided. Boom, you had a massive shed. And so that was not a surprise to us. And then I guess I'll just leave you with the long COVID situation, which seems to be this recurring phase of autoimmune dysregulation, let's say, and other issues that occur over time, creating these waves of shedding in the hair follicle. So I think it's a little bit more complicated than probably we realize still at this time. But I would say that inflammation, probably not a great thing for the scalp. Just as bad, I would say, as cortisol, which is, the stress hormone, and just as bad as having some kind of literal inflammation like itchy, flaky, dry, or seborrheic dermatitis or psoriasis activity on your scalp could cause some shedding and dysregulation of the hair follicle at the same time. So I'm glad you asked me about low-dose naltrexone, because that's really come to the forefront in the treatment of scarring types of alopecias. And we talked about frontal fibrosing alopecia in women, where it kind of recedes the hairline. There's a central centrifugal alopecia that happens in African-American women, that happens from the center outward of the crown, where they have repeated exposure to these perming chemicals and things like that, and hot combs over time. And we found that the low-dose naltrexone in some way interrupts that inflammatory process. And I think it's 4 milligrams a day for these patients, 3 or 4 milligrams a day. And it's amazing how well that treatment works. So that's a very new, exciting modality that probably most dermatologists never even heard of. But in the world of trichology, which is the health of the scalp. I have a certified trichologist. We have our own trichology department at Bauman Medical. They are very much on top of all of this latest and greatest information on low-dose naltrexone. And we have a very specific protocol for those inflammatory alopecias. So I don't know the answer to your exact question, but I would just tell you that low-dose naltrexone could certainly be helpful in those particular conditions. At least that's my experience in the practice, for sure.
No, I know. I love that low-dose naltrexone is getting some attention in that realm. I would say in the chronic Lyme realm, it's something that we've probably used for 20 years or more. And so it's been one of those things that people don't often know a lot about, but it's interesting to see that it's getting broader exposure now. You mentioned chronic Lyme disease. You mentioned mold. I love that you're familiar with those things and know about them. I'm wondering, have you seen some patients with hair loss that they had to address the mold in their home or environment in order to address the hair loss issue?
Yeah, well, absolutely. And some of them, unfortunately, never really got better. But here in Boca Raton, Florida, where my practice is based, I'm trying to think of how long ago, maybe like 15 years ago or so, we had a huge construction project out in West Boca where there was this Chinese drywall situation. I don't know if you remember that, but there was some Chinese drywall, huge shipments that came over and had like this black mold, and all this new construction was created with Chinese drywall. They had to literally like rip it out of the homes, but it wasn't until after people had moved in did they even realize that it was a big problem. And many of those folks, not all, but many of them had multiple medical issues from exposure to that over time. And I know I have had more than a few patients come in, and it's a desperate situation. Again, I'm not the expert in, chronic infections like that and detoxification. I mean, we send a lot of folks up to Virginia. Dr. Andrew Heyman is probably one of the people that comes to mind if we were making a referral. But the point is that certainly that kind of inflammatory process that's dysregulating so many organ systems certainly knocks out the hair. And unfortunately, it seems like that long, again, problem where it just seems to be chronic of shedding and weaker quality hair growth until things are kind of fixed. And you have to reboot their systems. I mean, again, I'm not the expert, but I listen to these presentations. There's almost like when you're rebooting your cable box and your Wi-Fi at home, you got to do it in sequence or else it doesn't work. And it's the same thing for these organ systems from chronic mold and Lyme exposure and all that. So, if there's someone out there with those conditions, and maybe you have better handle on the process for that. But yeah, you have to get that handled or else you're not going to grow good quality hair.
I have to say, I'm quite honestly blown away with how holistic your approach is to hair loss. I didn't expect that you would know all of these nuances that we're talking about. So super impressed.
Oh, thanks. I've been a member of the American Academy of Anti-Aging since 1998. So I've heard these very prominent physicians over time who are not counterculture to the traditional stuff that we learned in medical school, but just with a more holistic and functional approach. And I always was drawn to it. I always thought that there was something missing in the medical training that I had that, it just seemed to be all pharmaceutical based. And, for us to be told that lifestyle medicine, we were told lifestyle medicine didn't work. I mean, it's just awful to the fact that having been trained in the 1990s, that's what as medical students, that's what we were being told, that, you could put your patients on a lifestyle program, but it's not going to work. That you need to do this instead. You need to put them on the statin. You need to put them on this drug. You put them on that blood pressure medication, all that. So it's really, I felt that there was something missing. And I guess, I didn't know at the time exactly what that missing piece of the puzzle was, but I was attracted to these other more holistic physicians. And that's, I've been a member, like I said, of A4M and AMMG and other conferences like that for many, many, many years. So certainly open-minded about it. I'm a longevity buff myself. People say biohacking, and, I was a biohacker before there was the word biohacking. And so I guess, that's where it comes from, a passion for health and wellness, and to do that for my patients as well has always been a piece of the puzzle, looking for those other causes. And remember, I also have the luxury of talking to patients for about an hour if I want to, which is very different than like your local dermatologist who's going to maybe see you for 5 minutes. Oh, you have hair loss, here's the recipe. No, that's not how it works at Bauman Medical. Sorry.
So you mentioned that in the COVID, long COVID, spike protein arena that you've seen a lot of people coming in that were pretty stable. And after having COVID or exposure to spike proteins, they started having some recurrence of their hair loss issues. Are there certain interventions that you've kind of observed as being the most helpful in those people with COVID associated hair loss?
Yeah. So COVID hair loss is like turbo hair loss. And so what we need to do is attack it with a multi-therapy regimen. So if the person, let's just take a standard male pattern hair loss patient who has been stabilized or stabilizing on medical therapy like oral finasteride, maybe oral minoxidil or a topical or something like that. And all of a sudden, they're coming in, they're like, oh my God, I had COVID. Things are getting worse. We do a measurement. We can see the percentages are dropping precipitously. We got to get on top of it quickly. So PRP, platelet-rich plasma, might be the next intervention we might think about. Using the platelet-derived growth factors and other molecules that are locked inside the platelets and releasing them into the scalp is a fascinating and very, very powerful way. If you do it correctly with the right recipe and deploy it correctly, very powerful way to reboot the hair follicle and stimulate hair regrowth. I'm a huge fan of red light therapy, so we often use a turbo laser cap for our patients as an at-home device, medical grade, FDA cleared for hair regrowth. It's a beautiful device, elegantly designed, engineered to cover really from the hairline all the way through to the nape of the neck in a portable, powerful device. It just recharges with a battery pack. It's about this big, and you could take it with you on an airplane and fly around the world with it very easily. So combining those kinds of at-home therapies, medicinal, laser light at home, regenerative treatments, let's just say basic PRP and such. If they're truly in a shedding phase, one of the things I've found also that helps very, very well is a treatment called TED, transepidermal delivery of growth factors and peptides. So using a specific concoction that was designed by the Alma TED company of copper peptide and a thymosin beta-4 derivative and a number of amino acids and emollients and exfoliants and things like that to really treat the scalp and to help anchor the hair follicle was very, very helpful during COVID. We did a lot of work with that TED device while the patients were in the shedding phase, and it was beautiful. It was one of the most powerful treatments that we could use for an active shed that I've ever seen really in the history of the practice. So very exciting technology is available. And I would say today, it's more than just PRP in the regenerative space. We have exosome therapy and some other more advanced treatments as well that we can derive from your own hair follicle stem cells that we could deploy. But using all those kinds of different modalities together, in addition to that holistic approach, will hopefully reduce the need for hair transplantation later on.
Yeah, with all these new things that are emerging, it may put you out of your transplantation surgery business at some point, right?
Well, that's the goal of, my dad's a dentist. He's in his 80s, still practicing. And he always said that the goal of dentistry is to eliminate itself, right? To teach people how to take care of their teeth to the best of their ability so that you don't have to drill them and fill them, or replace them. But I think what happens in human nature is that most people, men and women alike, are sometimes in denial in the early stages of hair loss. And so, again, it is Hair Loss Awareness Month, so we will say for the umpteenth time that time equals follicles. So if you have a little bit of a symptom, a little bit of a shed, you're seeing a little bit more scalp shining through, that's your sign. This is your message right now to get that checked out, get a baseline measurement. Even if you decide to not do anything at all, maybe just take a biopsy or something, but just get a measurement so you'll know in a year if things you think may be looking a little bit worse or symptoms change, get another measurement and you'll know exactly where you stand. What is the natural progression of your hair situation? If you're prone to female or male pattern hair loss, it will get worse with time without treatment. So I can't state that enough. But yes, the idea, I have many patients in the practice today that if they stay on their regimen, they may never, ever need a hair transplant. And these are sons of daughters of hair transplant patients from a decade ago, for example, that we treated who are coming in an early stage, getting a measurement, making sure their holistic regimen is on point, that their nutrition and lifestyle and stress management skills are on point so that they never need something more aggressive, more invasive.
So before we step away from the infection contribution to hair loss, I want to talk a little bit about infections on the scalp. So malassezia, for example, fungal infections, maybe bacteria, maybe even things like Demodex mites, for example, is part of optimizing hair growth and minimizing hair loss to use topical antimicrobial shampoos or solutions to address direct microbial triggers.
Oh, that's an amazing question. So here's what's really important for your listeners to know is that the scalp, just like your gut, has a very specific microbiome. And so there are microorganisms that live happily, and we would encourage them to live on the scalp as long as there's the correct balance and ratio of one to another. And what we do know is that when things get out of balance, just like in the gut, when one microorganism supersedes the rest, malesthesia is a great example, you get havoc. And that malesthesia feeds on excess sebum and the skin cells that exfoliate. And if malesthesia starts to really take over the scalp, you're going to have a trigger for not just dandruff, but eventually seborrheic dermatitis and some major inflammation up there. It's going to be itchy, flaky. It's going to be annoying. And it could even become ulcerated. You could even have open sores on your scalp eventually. And so the microbiome of the scalp is not going to be cured by an antimicrobial shampoo. Now, sure, an antifungal in the short term may help decrease that malesthesia growth. And that's why dandruff shampoos work, whether it's parathione zinc or Selsun Blue or whatever it might be. All of those treatments can work, even ketoconazole antifungal treatment, not the most scalp friendly treatment, by the way. It also has some anti-androgen properties. So there is maybe some benefit there. But if you've ever tried to use a ketoconazole or an Nizoral shampoo on your scalp, you know that it is nasty. It turns your hair into straw, like immediately. It's just a bale of hay immediately. And so I will caution patients before they go down that road, please let us take a look at your scalp. Let's see what's going on. Get a scalp makeover first. Let's try to handle it in what I would consider a more holistic way. Really, let's try to rebalance the scalp before we just kind of do a smart bomb effect, with an antimicrobial or antifungal. We have the scientific scalp makeover in my trichology department. Kim is my certified trichologist, and they call her the scalp whisperer because she's amazing. And she has her team of people. All they do all day long is optimize the health of the scalp for our patients, either before or after hair loss situations, before and after hair transplant and recovery. And for those folks who are dealing with some, let's say, dysregulation of their microbiome of their scalp. So I think it's a new frontier. We're going to see more treatments and procedures come available to help fortify and support the microbiome of the scalp. And I think the only thing that goes along with that conversation is how often you should shampoo and condition and with what. And I know that's the next question. There's no easy answer for that because everybody's scalp and skin is different. And your skin 10 years ago is different than it is today. And it's going to be different 10 years from now. So it's just like skincare. It evolves over the course of your life, just like with hormones and nutrition and other things that can change. So can the condition of your scalp. And so there's no easy answer for that. But that's why I always refer to Kim, my trichologist, if you have a question like that.
So it'll be interesting to see in the future if we're using topical probiotics directly aimed at scalp health for improving hair growth.
Yeah, I'll tell you, we're already working on that. So we're working closely we're already there. We're doing some work with local universities and researchers on that to determine the hair follicle microbiome and its composition and things like that. So, what we're finding is that there's a wide variety and wide variation, and that, even right after you shampoo is different than the next day, 24 hours later. So, there's some really, really interesting things that happen. And of course, think about this for a moment. When it comes to a smart bomb, an antiseptic wash is what we're doing right before we do a hair transplant. It's literally chlorhexidine. It's HibaCleanse, we're cleaning the scalp. But the microbiome of the scalp actually rebounds much, much quicker than you could actually try to destroy it. So you can never fully sterilize the scalp, which is an interesting thing. So optimizing it prior to a procedure is really what we're aiming for, not sterilization. I guess the similar thing would be like for the mouth. You can't sterilize your mouth, do dental work, but you try to clean it and do the best you can. Same thing for the scalp. It's antiseptic or an aseptic type of procedure. And thank goodness, infection rates with hair transplantation are very negligible today. Your worst infection from a hair transplant is basically like a pimple, especially if you're doing the modern minimally invasive kind of work like we're doing without a scalpel or stitch or staples.
Well, and we even know now there's more research coming out showing that if you're using mouthwash consistently and really carpet bombing your microbiome, that affects negatively your nitric oxide that has systemic effects. And so definitely the killing approach is not always the best strategy.
Oh, you're quoting my good friend Dr. Nathan Bryan, who's also one of our more public patients out there. He has accelerated his recovery from transplantation with the nitric oxide lozenges that he personally developed, and it is amazing. You can watch his progress on his Instagram feed, and I think he wrote a whole article about how he used nitric oxide supplementation to basically biohack his way through the healing process with after his hair transplant, which we just did recently. But yeah, I've been a big fan of Nathan for very many years, and so we're happy to actually have his products here. And I'm a proud user of his toothpaste, which is microbiome friendly toothpaste. So I think what you're aiming at is a microbiome friendly shampoo, and so stay tuned. Like I said, we were working on that. It's coming soon.
Talk to us then about the role of micronutrient deficiency in hair loss. Do you look at things like a NutriVal or a Vibrant micronutrient test? And what are some of the more common nutrient deficiencies that negatively affect hair growth, hair loss? And then are we thinking about repleting those nutrients, or are we thinking more about looking to the gut and using more enzymes and things like hydrochloric acid, probiotics, leaky gut, those kinds of things? Where does the nutrient deficiencies fit into the discussion?
Yeah, Scott, I like all of the above, actually, but I would focus the discussion on nutrients first, on protein. So it's really important with all the micronutrients that you just mentioned and all the testing that you just talked about, which I would never toss away in any way, shape, or form or minimize. I think probably the most important thing is to get enough protein in your body, because it's very clear that if you're protein deficient, you're not going to grow hair. And the starkest example of that are starving kids in Africa. And all of us have seen those photos, whether when we were younger, National Geographic, or you can go pull them up on the internet. Those kids are on they're eating porridge or something like that. They're totally bald. They have no hair. And the reason why they don't have any hair is because they're protein deficient. So caloric restrictive diets, and it include fasting, and I think we may have mentioned GLP-1 agonists like Ozempic and the like. Those are all going to put you in a caloric deficit purposefully. Obviously, if you want to burn fat, lose weight, get leaner, and so forth. You may also lose bone and muscle, by the way, if you do that without appropriate resistance training. But you will also lose hair, because the hair follicle is very sensitive to that feed or fasting signal, if you will. And so the hair follicle is like a luxury item in the body, essentially. And again, that's probably why it's so valuable, right? Because if you're a little bit undernourished, you're not going to grow good quality hair. You're not going to be attractive to that cave woman who's like grunting at you across the cave under the campfire light there. And you can't speak to her, but you can look and check out her hair, and she's checking out your hair and seeing if you can propagate the species, a million years ago. I'm just imagining that that's how that worked. That hair was an important sign of that. So if you're nutrient deficient, just like a male bird with a plumage that's colorful and stuff, that has based on their diet, right? Same idea. So the point is that if you're protein deficient, you're not going to grow good hair, because literally, as someone has listened to this discussion today for, let's say, an hour, 150,000 hair follicles on their natural healthy scalp, producing hair at a rate of about 1/3 of a millimeter a day. They've already grown about 6 feet of hair total while they've listened to this podcast for an hour. So that's quite a metabolic commitment of protein. So, but of course, to work the follicle, you need all of those macro and micronutrients as well. So B vitamins, and making sure that you've got your adequate micronutrients on board so that you can convert all that great protein into that beautiful hair fiber. So we like to supplement not just things that we find in our DNA testing, or if we find a DNA testing that you might be deficient in protein, or not protein deficient, but deficient in collagen, or predisposed to that, or predisposed to deficiencies in minerals, that we do testing for all of that, as you mentioned, and those are great tests to figure all of that out, supplement that. And I guess it just leads into that conversation that, well, if you're not sure what you're deficient in, maybe you should go and do those tests. And then if you're on a caloric restrictive diet, you want to make sure that you're supplementing with the protein enough so that you can maintain your healthy head of hair while you're doing it. I have my own collagen and multivitamin products, as well as a probiotic. These are all specifically fine-tuned for hair and for hair growth specifically, although they do have great benefits for skin as well. And then we also do curate the more commonly known ones like Nutrafol and Extresse, which is the new hair candy, sugar-free hair candy, I guess you could call it, as well as Viviscal and things like that. So we've used those kinds of nutrients and nutraceuticals over the years, the ones that have specific scientific background. So yeah, nutrients and fuel, really important to grow good hair.
So it's interesting. You were talking about how you saw in the COVID era so many more people coming back with hair loss issues. I'm wondering, it sounds like there is also potentially overlap with the number of people now that are doing GLP-1s as well in that same time frame. And it sounds like you're seeing some negative impact on hair in those people that are on some of these semaglutide and tirzepatide and those types of things as well.
Oh, it's a huge problem because, again, the caloric restrictive diet is designed that way. And the caloric restrictive medications specifically either to slow your metabolism, to slow your gut motility, to decrease your appetite. You're in a caloric deficit. It's mostly, and it's going to be protein as well. You're going to lose the fat. You'll lose the weight, but you're also going to typically lose some hair. And that's been a huge increase of patients coming through the door that we've seen with the Ozempic-related hair loss. It's a very common problem for sure.
Extending then on medications, when we think about antidepressants or antihypertensives or antacids like PPIs or birth control medications or anticoagulants and anti-seizure medications, and so many people being on statins and those kinds of things, how often do you see those types of medications having an effect negatively on hair? And can birth control pills be both potentially helpful and harmful for hair growth?
Yeah, so I have a list of medications on the website that we see commonly trigger hair loss. And I think you mentioned most of them: the antihypertensives, the statins, the mood stabilizers, of course, hormone optimization. We talked about that already. And hormones, as we said, if it's an androgen dominant person and you're adding androgens into that situation, it could be a problem as well. Birth control, sometimes you'll have a detrimental effect on your hair, and other patients seems to have a positive effect on their hair. So difficult to say until you try it. And that's why the measurements are so important. And sometimes switching from one to another, maybe androgen dominant or not, can be helpful, when it comes to those oral contraceptives for sure. I'm trying to think of the name of the one that's without the androgens. It's just escaping me at the moment. Yeah, those are critical triggers for hair loss routinely, and probably everybody knows someone who's on a blood pressure drug, antidepressant, and a statin all at the same time. I mean, that's like super common out there. That's like the trifecta. That's like when you go to the primary doctor, they put you on all that automatically, don't they? Oh, there's one nutrient I want to really mention. It's important. Vitamin D deficiency, we know, has been specifically linked to hair loss. So if you're going to test like one thing, maybe you want to figure out if you're vitamin D deficient, or if you, like every ER, they just automatically prescribe vitamin D because they know that so many people are deficient in vitamin D. But we know that there's a specific relationship between vitamin D deficiency and alopecia. So I just don't want to let that nutrition discussion go without vitamin D3.
So talking then about some nutrients, we also know that excessive amounts of vitamin A or selenium or iron can negatively impact hair. So in the chronic illness community, many people have genetics where we tend to overabsorb iron, and particularly in men who don't have a monthly cycle, the body's ability to dump that iron is somewhat limited. So I'm wondering, when it comes to hair, do you see more iron deficiency or iron toxicity?
Yeah, in our men, I'm not so convinced that it's related, just in my personal practice. But in women, for sure, we're going to check their ferritin levels. If their ferritin is low, meaning below 50, which is still in the normal range, actually. Most labs will tell you like 20 and above or so is normal. But if you're below 50 and you've got a hair loss situation, you definitely want to try to bump that up. And sometimes it's dietary. Sometimes it has to do with their monthly cycle being heavier or not. Sometimes, again, it's just genetic. And a lot of women do struggle trying to boost up their ferritin level, and there's no one easy way to do that, I think. But that's something we certainly look at. Ferritin, is the iron, and oxygen carrying capacity of the blood, essentially. So if you're not delivering oxygen to the hair follicles, you're obviously not going to grow good quality hair.
Let's talk a little bit about supporting circulation to optimize hair growth. So we talked a little bit about the potential of nitric oxide being helpful. What are some of the other tools you're using in that realm? Do you find pulsed electromagnetic field potentially helps? It sounds like photobiomodulation or red light therapy helps. And is that primarily from increasing circulation, or is that also where I'm going to go next in terms of increasing mitochondria?
Yeah, well, we know red light therapy does both. The mechanism of the action of photobiomodulation, elucidated by Dr. Michael Hamblin from the Center for Photomedicine associated with Harvard over there and Mass General. He elucidated all of the mechanisms of how that red light wavelength gets absorbed at the cytochrome C oxidase inside the mitochondrial membrane, and you get this increase in ATP production, the energy, if you will, the energy currency of the cell. And as we said, highly metabolic cell population, therefore uses a lot of energy. So good to have the ATP around if it's weak. We also know that red light therapy, great for wound healing, anti-inflammatory, pro-circulation. So when you use, for example, the turbo laser cap, as I do, within 10 seconds of applying that to my scalp, I can feel that pulsation happening just almost immediately. I feel the blood circulation improving to the scalp. So I know that there's an absolute effect there. And that's been seen through many, many different types of studies that the red light does dilate the blood vessels. So that's non-chemical. Minoxidil, another great tool that we use that's been shown to increase the microcirculation. It has other effects on the hair follicle as an anagen prolonging and stimulating agent, but we do know that minoxidil increases the microcirculation as well. So when you combine red light, minoxidil, nitric oxide, you're really hitting the circulation. And there are DNA tests, SNPs, if you will, single nucleotide polymorphisms that are related to poor circulation. So if you know you're prone to poor circulation as you continue to age, that's where you should investigate and dial your treatment regimen into something that's going to be more along the lines of nitric oxide, red light, minoxidil, that type of thing.
And do you find that systemic supplements to support the mitochondria, let's say CoQ10 or PQQ, urolithin A, NAD precursors, does any of that seem to improve hair growth potential?
Well, I don't know about any data to support that, but I'm certainly a big proponent for improving mitochondrial health when it comes to hair follicle function. Again, we just said lots of energy is being used to create hair around the clock. So if your mitochondria is failing, you're going to have a hair follicle dysfunction for sure. So I'm on board with all of that for sure. I just don't have any data to tell you.
Do you find that in some people, high levels of toxicity correlates with hair-related issues? Meaning if they have high levels of heavy metals and chemicals and pesticides, and we talked about mycotoxins from mold, is there a need for or a benefit from a systemic detoxification component of a treatment protocol?
Well, to be honest, we don't really screen for heavy metal toxicity when it comes to hair loss, unless they've already had some kind of indication that that may be an issue. I certainly wouldn't dissuade someone from doing that. I'm fully on board with detoxification protocols and procedures. There's so many different things that you can do, from total plasma exchange to EBOO, extracorporeal blood oxygenation, and a variety of different things. Even sauna is going to help get some of those toxins out of the skin. And that's one thing that we also didn't discuss during the circulation thing. So I'm a big fan of far infrared sauna for scalp improvement.
There is some discussion about exposure to electromagnetic fields in our environment causing oxidative stress and reducing melatonin, disrupting calcium, impairing blood flow, creating inflammation. Have you seen any connection to someone that had high levels of EMFs in their environment and that affecting their hair?
I haven't seen that directly, but I can certainly believe that that would be a strong effect. I'm a huge believer of pulse electromagnetic field. I do use it myself for muscle recovery after workouts. Sometimes I do feel some shoulder issues from the operating position that I'm in ergonomically. I'm trying to work on that. And the PEMF devices that I use, the Halo and also Pure Wave, have helped me a lot to decrease that inflammation and treat myself over time. We also use a lot of those modalities to help our military veterans. I volunteer at Gray Team, which is the facility here locally, a 501c3. And so we use pulse electromagnetic field to decrease inflammation, decrease pain for those military veterans who are suffering from PTSD and also have other injuries. And so if we can help them with PEMF, I think just about good for everybody else too. So I'm on board with all that modality.
What is the connection between hair loss and the WNT pathway or wingless related integration site pathway? And are there specific tools we can use to reactivate that WNT signaling to support hair growth? Or do we need to be concerned about potentially overactivating that pathway in terms of the potential for cancer development?
Yeah, so it could be a double-edged sword, as you said. Overactivating the growth features of the body can sometimes push us into that overgrowth. And so I think when I just look at the body generally, I think we have to go through these cycles of growth and rest and digest and so forth. And so just like we would cycle, whether it be peptides or other modalities, to whether it be intermittent fasting or doing a 3-day water fast, and then you come out of it and refeed and so forth. I think it's really, really important to consider, what the risks are of overstimulating. You obviously don't want to create any cancerous lesions or melanomas or anything like that on the scalp. But what I do know is that there are some very, very smart researchers who are trying to leverage the Wnt pathway to produce hair follicle enhancing treatments and procedures. So, for example, Maxim Plikas, I think he's out of UCLA, he is working very hard on looking at hairy moles. So these are essentially birth defects that grow a boatload of hair in infant populations. And so he's done a lot of work figuring out that you can basically hyperactivate the follicle if you leverage these Wnt pathways. But Wnt pathways are accessible, meaning that even if you use minoxidil or if you use certain types of exosome therapy or microneedling, you can activate these pathways and stimulate better regrowth. But just like anything, let's just talk about microneedling for a moment, or even derma rolling that people do at home. The microneedling derma rolling is microtrauma. If you overdo it, then you're going to cause excessive healing response. You're going to cause scar tissue and inflammation. And so there's kind of a delicate dance between stimulating those pathways of healing, even with platelet-rich plasma and such, and then providing that healing response so that you get the accurate and effective growth result that you're looking for and not overdoing it. Plenty of patients of mine, unfortunately, will go home and they'll buy some derma roller off of Amazon and, think that they're doing good deeds by rolling their scalp every night when they're putting on their topical medication, but they're using too deep of a needle. And it's causing excessive trauma and actually triggering more hair loss than regrowth. So I would just caution people about trying to trigger their own Wnt pathways through using a cheese grater or something like that. Be careful out there. Let the professionals do it. And so there's a very specific reason why we wear loops while we're doing microneedling, so that we can see the tissue response and not overdo it in one area versus another.
So getting into some of the treatment options, we talked about the systemic medications like minoxidil, finasteride, dutasteride. So I want to focus a little bit more on some of the topical medications. You talked about using genetic testing like the Trico test, which can look at specific ingredients that you potentially could use in a topical formulation that might be more effective for a given person. It sounds like you're finding value in that, looking at their DNA and then incorporating that into a topical or into some of the other treatment interventions that you're doing. The most common ingredients that I've seen in topical formulations are similar: minoxidil, finasteride, dutasteride. I know you have formulations that you've created like 82M, 82F, 82D with those exact ingredients: minoxidil, an anti-androgen, trentinoin, as well as a corticosteroid. So are those formulas that can be used by both men and women? How effective are they? And then what should we expect in terms of tolerance, shedding, or experience with those topical formulations, at least in that introduction period?
Yeah. So my experience with Formula 82M, for example, goes back 20 years. So I'm probably one of the most experienced physicians in prescribing that particular compounded version of minoxidil. And the reason why we sought out that particular type of product is because we saw that the traditional over-the-counter versions of minoxidil or Rogaine that you could easily buy at the supermarket were greasy and gooey and very often irritating. And as we mentioned previously, sometimes they just didn't even work at all. So the benefits of a compounded version of minoxidil is not just the ingredients that you mentioned, because certainly the ingredients are important. You want to make sure you have enough minoxidil. The tretinoin actually ramps up the sulfotransferase enzyme, which we previously talked about, so that the minoxidil will work better in patients where their sulfotransferase propensity for activity is low. So It will also increase the penetration of the minoxidil. And then the fluocinolone that's in there decreases the chances of inflammation due to putting anything on your scalp. Those of us who are here in this part of the world who are light complected, maybe Eastern European descent, their skin is going to be more sensitive than those who have more, let's say, a Latino or African American population. They're simply less sensitive to things that you put on your scalp. So that's the purpose of those ingredients. But the big benefit that's often overlooked is the vehicle, because the vehicle recipe is not on the bottle. And actually, it's proprietary. And I didn't think it up. I mean, I wish I did, but it was brought to me to try by a group of dermatologists and pharmacists that started in South America, actually, and then brought it to this country many, many years ago, like decades ago. And so when we tried it on our patients, what we found is that 82M was so far superior to the propylene glycol-based typical minoxidil foam and such that you would get over the counter, and even some of the locally compounded versions of minoxidil, which were high percentage versions. This went on much cleaner, much drier, with a lot less irritation. It absorbed much more quickly and had a much more robust hair growth effect on the back end. So 82M has a special place in my heart because it was like the OG. It was the original alternative to Rogaine that actually worked. So we used to recommend Propecia Rogaine. Like we're talking 1990s, right? That's minoxidil, over-the-counter, Propecia prescriptions, finasteride. And what we noticed is that the people using the minoxidil Rogaine that we recommended over-the-counter always stayed the same, meaning that the more people I put on the medication, the more people fell off, until we went to compounded topicals like 82M. And what I found is that using compounded topicals, patients became more and more and more compliant. They stayed on it for a much longer period of time. So the total number of patients increased dramatically in terms of who was on these topical medication like minoxidil. So, and what we found on the back end is that they grew better hair, right? Because compliance is the key to the whole thing. If the product is too greasy or gooey for you to use twice a day religiously, you're not going to get a great result. So that's 82M. 82F is the same product plus finasteride. 82D, same product, minoxidil plus dutasteride topically. So those are some really, really great compounded medications that we use. When would we go from finasteride or topical finasteride to a topical dutasteride, or when would we switch someone from 82M to 82F, from just a plain minoxidil to a finasteride? A lot of it is a discussion of, will you take finasteride orally, or are you fearful? And if you're fearful, let's use the topical version of finasteride. Or we've done a genetic test, and it shows us that you have a high propensity for conversion, let's say at the type 1 5-alpha reductase pathway, which is not blocked, by the way, by finasteride. If you have a propensity for high type 1 5-alpha reductase activity, you should be on dutasteride, because that little tiny pathway in most patients that's making a little bit of DHT in you is making, or likely to be making, a lot more. And so your response to finasteride is going to be blunted because more DHT is squeezing through that other enzyme pathway. So that's when we would think about dutasteride.
Is the concentration of minoxidil the same for men and women? I commonly see 3% for women, 5% for men. I've seen higher, but then also you have the potential of rapid heart rate and other potential side effects from systemic absorption of minoxidil. So what percentage do you generally like to use?
Yeah. So the 82M products are all 5%, and I've had great success with that. And I think once you start going higher than 5% on these specialty recipes, well, it sounds great on the bottle and on the website, but when you actually get the product, it's nasty. It's just, you can feel it before you even put it on your scalp. Just put it on the back of your hand and roll it around for a second. It's just so nasty. And believe me, I'm a hair junkie. I've tried them all. But the cloud pharmacies, they think they're very clever. Oh, we're going to put some caffeine in there, or the eyelash growth drug, Vimatopros. Well, that's okay and great. But I will tell you that the products that they're providing with the vehicle is so poor. They forgot to deal with that compliance piece of it. Like, what is the user experience? And if you just create a better user experience with a topical, you're going to get 10 times the compliance and 10 times the hair growth. So that's been my experience. I don't know, maybe other doctors have other opinions, but that's just me. I know that when I was using a topical, that it was much easier to use something that wasn't making a mess out of my hair.
So with tretinoin that's in those formulations as well, that is a vitamin A related substance. Wondering if people have difficulty tolerating that in some cases from a skin tolerance perspective initially. Do they maybe need to start with a lower amount of tretinoin and work up over time, or is that generally not an issue for tolerance?
Yeah, the tretinoin is really not an issue. If you think about tretinoin has been used on the skin of the face for many years as an anti-aging product, for example. Yes, it is a vitamin A derivative, but remember that there's just a whiff of it in there. Now, are some people more sensitive to it than others? Yes. Does it make your skin more sensitive to sunlight? Yes. So there are some considerations. The good news is that we can modify it. If you happen to be very light complected, light eyed, you're going to have more sensitivity to whatever we put on your scalp. Maybe we have to switch gears and use a peptide formulation instead of a tretinoin or prescription based minoxidil. Or maybe we switch you to an oral minoxidil instead. So there's a lot of ways around the barriers that we find, or replace your treatment with something more regenerative like a PRP or exosome therapy or TED type treatment. If you're local, you can come in for those therapies and treatments over time.
So I want to get to some of those conversations as well, but I want to ask, you kind of alluded to some of this, but there's a number of things that people do add to topicals based on the tricho test. So wondering latanoprost, spironolactone, cetirizine, levocetirizine, vitamin D, caffeine, melatonin. I mean, we see all of these things being talked about. Do any of those cut the mustard for you in terms of having potential benefit beyond the things we already talked about?
I think all of those have the potential to enhance the results from treatments. I will tell you that I think it's a smidge. It's not a huge, heroic, massive improvement over kind of our standard topicals. And I think when you start compounding all of these things in there, yes, again, it looks great on your website that you're so clever. You figured out all these new things. We've done AI-powered combinations, not just for our hair care formulations and things like that. What are the potential benefits of adding latanoprost or bimatoprost to the treatment? I mean, we were the first to use Latisse on the scalp, to be honest. I mean, that was like a groundbreaking thing back when we were featured on the front page of the New York Times when we did that. What the point is that sometimes when you start adding all of these things, you diminish the usability of the medication. So the juice is not worth the squeeze. But yes, I love caffeine, green tea, saw palmetto. Those are ingredients that we put in our hair care products for sure. Our conditioners, which are going to sit on the scalp, our shampoos that are going to cleanse the scalp. Sometimes we apply those during a therapeutic scalp treatment session, or a scalp makeover. But it would never replace the more traditional, more powerful therapies like minoxidil, finasteride, dutasteride, those types of things.
So let's talk a little bit about peptides. In the chronic illness community, we use a lot of peptides these days. They're very popular for immune modulation, for regeneration, repair. In the hair loss arena, there's things like PTD-DBM, sometimes combined with methylvanillate. There's combinations with valproic acid. There's also things like copper peptide or GHKCU. More recently, I'm seeing GHK biotin. Wondering if you can talk a little bit about what's really emerging as helpful for hair growth in that topical peptide space.
Yeah. So, I mean, you're basically describing my PepGrow, which is our peptide formulation. It's an AM/PM. It has the copper tripeptide for the morning use with the thymosin beta-4 derivative, snippet, if you will, and then the PTB-DBM and methylvalinate is the evening dose. So there's the AM and the PM versions that we use, and we've seen excellent regrowth with that. Is it something that I would prescribe over, let's say, a compounded minoxidil, like a Formula 82M? Probably not. I would probably try you on the 82M or similar kind of compounded topical minoxidil first. But if you had some sensitivity, systemic absorption with minoxidil from a topical is very, very low. And I've really only seen side effects from a topical application of minoxidil in a patient one time out of 35,000 patients. And he must have been applying it like 6 times a day to try to get his hair to grow. And honestly, his scalp was so red and inflamed. I mean, I don't know what was going on there, but obviously he was overdoing something. So it's really, really kind of important to understand that if you had to swap out maybe that more traditional tried and true minoxidil or finasteride topical, that's where we would go to the copper peptide and other peptide containing ingredient like the PepGrow.
And you mentioned minoxidil side effects, but I assume it is common to have shedding with the introduction of a topical, but that's a short-lived side effect and not something that we're really considering a true side effect, right? That's kind of an expected part of the process.
It's really important for your listeners, Scott, because the dread shed is what we're talking about. As follicles, as we mentioned before, cycle on, cycle off, and then cycle on again, they're going to push out an older resting hair fiber. And so if you turn on a lot of follicles, you're turning all those 3D printers are turning on at the same time. They're going to start to make a new hair. You're going to push out from the scalp an effluvium of shed. So I tell patients, don't panic. This is going to take 90 days to resolve. You're going to see the improvements in your measurements. So in 3 to 4 weeks, you're going to maybe going through a shedding phase. Push through. Don't look at it too closely. And I guarantee, and I've seen it time and time again, the more the shed, the better the results on the measurements in that 90-day interval. And of course, it just continues to get better from there, right? So they're coming in at 6 months, 9 months, 12 months, continuing to improve on a treatment. So yeah, just that is an expected result of stimulating a lot of hair at one time. So PRP can do it. Laser light therapy, if you're doing a rigorous like turbo laser cap regimen, 5 minutes a day, just starting it, or topical minoxidil, those are all very, very strong triggers for anagen. And that's where you're going to get that effluvium of hair, exogen of hair, as you mentioned previously, out onto the scalp.
I want to talk for a moment about shampoos. I know you have a Formula 82S, you have a Boost, you have a Soothe. So are shampoos with anti-DHT ingredients, are they on the scalp long enough to make a difference? How long should they be on? Are shampoos a key part of a hair loss protocol?
So shampoos and conditioners mainly are designed to cleanse the scalp and cleanse the hair. Conditioners, of course, impart the moisture back to the hair shaft. So traditionally, you wouldn't want to sit around with conditioner sitting on your scalp unless, of course, it contains a therapeutic ingredient. And certain types of shampoos, we had mentioned ketoconazole, for example, which is an anti-androgen and antifungal, actually works best when you apply it to the scalp and let it sit on there for 6 to 8 minutes before you shampoo it out. So a quick 20-second bit of business with a nizoral or ketoconazole is not going to help your fungal infection, obviously. So you really have to sit with it. So I'm convinced that if you do sit with things onto your scalp, you can get a positive response. And I would think that if you're going to put stuff on your scalp, which can penetrate through the skin and certainly down the follicle, we know that that's a conduit for large molecules for sure. You would want something that's healthy and pro hair growth in there. And so that's why I've included caffeine, green tea, saw palmetto, and a bunch of other proprietary ingredients like Capixyl and things like that, that will actually have been shown in clinical studies to help with hair growth. Now, of course, if you're shampooing on and off in 10 seconds, probably not going to do much. But we always recommend for patients to really lather it up, let it sit in there for a bit if you have the time to do it. And the same thing with the conditioner. And of course, it's going to have the same effect on the hair fiber. If your hair is thin or light, it's a very lightweight conditioner. It's not going to be overwhelmingly heavy. If you have coarser or thicker hair, you might need a more durable conditioner, a more long-lasting conditioner, a thicker, or even more like an oil, for example. Think of the extreme, right? You have a beard, a coarse, curly, wiry beard. Why do they sell beard oil for that? Well, it's because of the curls. So I'm not saying you need beard oil on your scalp, unless, of course, you've had a beard transplant to scalp, which is something that we can do for you, actually, in patients who are donor depleted. But the point is that I think ingredients are important, and you want good quality ingredients. You mentioned the Boost shampoo and my Soothe shampoo. Soothe also contains a CBD component, and CBD on the skin has two very important mechanisms. One, it's been shown as an anti-inflammatory, so that's good for scalp health in general if you tend to be more irritated or inflamed. But also there is some clinical data out there that shows that CBD can stimulate hair growth. Now, is it a miracle? Is it minoxidil? Probably not. But it does have some of those properties, according to the clinical literature. So I say, hey, here's a double whammy. Less inflammation, maybe some good hair growth. Let's put it in the Soothe shampoo. So that's under the Bauman MD line. Soothe shampoo and conditioner, and then the Boost shampoo and conditioner is something that patients can use. They can alternate if they like.
One of the common things that you see as particularly men start to lose hair is that really shiny scalp, that sebum buildup. So wondering if that's something that occurs both in men and women, and do we need to address that? Are things like salicylic acid or zinc PCA in a shampoo the best ways to remove sebum? And does removing sebum then help with hair growth?
Yeah. So I guess a lot of folks will ask in a different way. They'll be like, oh, my hairstylist said that my hair follicles are clogged and that I need to shampoo more often to remove the sebum to grow better hair. Well, I can tell you from a surgeon's point of view, if I bury a follicle under the skin, hopefully by mistake, and I didn't mean to, but it gets caught under the skin, that follicle will continue to produce hair until it finds its way out to the level of the skin, like a dandelion through a concrete sidewalk. So a little bit of sebum in your pore, if you will, or in the follicle is not blocking the follicle. However, when the follicle shuts down, let's say due to male pattern hair loss, the sebaceous glands do not. They still, and every follicle has a sebaceous gland attached to it about a third of the way down, which lubricates the hair shaft as it exits the skin. And so as the follicle miniaturizes, those sebaceous glands might shrink a little bit, but they still are active. And so that's why the scalp appears shiny in a bald area, because that sebum is not getting transferred down the hair shaft. Now, does removing the sebum create any benefit? Well, only if it's creating havoc. And we already talked about the overgrowth of malassezia and some other microorganisms on the scalp that feed off of sebum and skin cells. And so basically, if you get this overgrowth of these microorganisms, it can create a lot of inflammation. So the answer is maybe, I guess. So if we're looking at the scalp and there's inflammation there, we definitely want to take a look and see exactly what's going on. We might try a therapeutic intervention to clean up the scalp, to exfoliate the scalp, maybe put you on a better hygiene regimen. If you're doing too much or too little, we want to balance that out. And I think that's the key for any patient.
You talked a little bit about PRP or platelet-rich plasma, which can be injected into the scalp, those growth factors to help with hair growth. How many sessions might someone need to see visible improvement with PRP over what period of time? And then maybe the bigger question, how does someone find a doctor that's been trained by you in their local area?
Yeah. So PRP has changed a lot over the 20 years that we've been performing it. And I guess years and years ago, what we provided was unfortunately a very weak concentration of platelets, and we just didn't know any better, unfortunately. What we found more recently, and this is through research that's been done in the orthopedic world, that the concentration of platelets is directly responsible for what we're trying to get at in terms of a physiologic effect. So let's just say stem cell mobilization. We know that the higher the platelet concentration, the more stem cell mobilization. For sure, that's been documented in the literature. Let's talk about new blood vessel formation. That would be good also for follicles and such, even for skin rejuvenation. And so we know there's a dose response. There's a sweet spot, a specific concentration of platelets in PRP that will trigger the maximum new blood vessel formation effect. Now, learning all of this and then implementing it into our PRP process took some time. We now do what we call a dual spin PRP process. And this is very, very important. Most dermatologists and other practitioners and med spas will take a sample of blood and a couple of test tubes and put it into something that's basically one step above a salad spinner and think they got PRP in the yellow part of the blood. And it's just not the case. That is platelet poor plasma. Especially if they're using a gel separator test tube, they may have lost the platelets in that gel separator, to be honest. And what they're providing is almost a placebo treatment. Not any better than just putting some kind of moisturizer on the skin while they microneedle, for example, much less injecting it. But what we do know is that when we fine tune the platelet concentration, we can get a powerful effect on the hair follicle. And so I have a recipe for that. We know that that new blood vessel formation is at 1.5 million platelets per microliter. That's the dose that I want to get for every PRP patient. So we take a blood sample of the patient's whole blood before we make the PRP, and we can fine tune the concentration using a dual spin to exactly 1.5 million platelets per microliter, or pretty close to it. And so that's a trick, if you will, a protocol that we do teach. It's not simple. So many people come in and learn that protocol, and then they go home and they do their old protocol, unfortunately. So I would just suggest that if you're thinking about doing PRP, and there's a lot of other nuance. I think did we mention that I also use photobiomodulation on the syringe so that we use different wavelengths and frequencies of light to release different types of cytokines and growth signals from those platelets before we do the injection. We can also pair that with a scaffolding, and the scaffolding may be a biologic material like a perinatal biologic, like an umbilical cord tissue, or it could be a synthetic scaffold like polydioxanone threads. And this enhances and prolongs the effect of the PRP. In addition to that, we can add exosomes to it, which is the latest and greatest in stem cell therapy, using these nanoparticles which come from stem cells that are designed for tissue regeneration and repair. And we can pair that with the PRP as well. So there's a lot of nuance, not just how to prepare the scalp, pair the PRP, choose the correct patient, fine tune the deployment of the PRP and the correct levels of the scalp, and doing it in a painless way is probably one of the most important things, that we can just do a single treatment, which will last for most patients, not every patient, but most patients for about a year. So 90% of patients, 10 to 14 months of boost with a single treatment. If you're doing it the other way, I'm not saying you're using a salad spinner, but you get the idea. Using a tabletop centrifuge with a gel separator tube that all the reps love because they're selling you boatloads of kits, by the way, that you're going to need to go back to the clinic probably every month for a series of treatments to get something done, because it's just an antiquated way to perform PRP compared to what we're doing today. We're going to deploy literally 11 billion platelets or more into the scalp with our PRP. We're going to capture every platelet in the blood sample that we harvest from you on the day of the procedure. So it's a very nuanced process. So if someone's interested in getting a PRP, I suggest that they go to baumanmedical.com, check out the information that we have there, and start their journey from there. They can request an evaluation. They can even just simply ask a question. baumanmedical.com/ask, A-S-K, B-A-U-M-A-N medical.com. And if you go to /ask, you can type in your question. Please put in an accurate phone number or email so I can actually get the response back to you. And I will reply to you personally or with my team to get the information that you need about your hair loss situation.
So a few questions as we start wrapping up. So you mentioned exosomes. So is that commonly done with PRP? Are injectable exosomes something that are done in some cases standalone? And I'm seeing more and more topical exosome products that are emerging in the hair loss realm. Is there any value in those?
Yeah. So in terms of compliance for the moment, let's just talk about the fact that even though there's a new stem cell law in Florida, which allows us to do some different things with appropriate informed consent and CGMP protocols on the side of the manufacturers, the FDA still has warnings against injections of exosomes. So when we deploy exosomes in the practice, we spoke about using TED. That's one way to do it. We can also use exosomes with microneedling. I have heard lectures where a physician will get up on the podium and say that he injects exosomes. You will never hear me say that. So the point is that we still have to adhere to really the regulations that are out there before jumping into the deep end of the pool, let's say, even though things I think are changing now with the administration and also, again, these local laws that are happening in the state of Florida, maybe even Montana. We'll see how that works out. But so my point is that exosomes are an amazing technology. One of the most incredible ways to use exosomes today, in my opinion, is to soak the grafts while they're outside of the body, awaiting transplantation. Well, we have a special solution, and we have red light therapy that's going on and a thermoelectric cooling tray at a specific temperature. But now we've added exosomes to that solution. And when we put those follicles back into the scalp, what we're seeing is a sooner regrowth of the transplanted result than ever before. I'm talking like an 8-week acceleration, which is super exciting. So Juvexo H is that company that first used this product to do that. And it's been an amazing change. Actually, think about it. 4 months out from a hair transplant, usually as a psych consult. What do I mean by that? I mean, it's like, don't worry, it's going to grow. You're going to do fine. Hang in there. 99% of it's going to grow. Just got to wait. Well, now, 4 months out, we would normally not really speak to the patient because we usually don't expect much growth. I'm getting text messages, emails, phone calls like, oh my God, you got to see the growth coming in. So It's a pretty exciting change that I haven't seen in 27 years, 28 years of being in hair transplant surgery. Now I have to make a change really to my post-operative protocols so that we can track these results that are happening so much sooner. It's amazing.
So let's talk then a little bit about transplantation. Are transplants or grafts today still placed by hand? Are they done with robotic machines? How much should one generally expect to spend on a transplant? Is it usually one and done, or do they need to do several of them? And then usually if someone does a transplant, are they then still after doing all of the other things that we talked about in this conversation?
Yeah, probably the most important thing is that if the hair follicle is dead and gone, miniaturized beyond repair, and you want hair coverage in that area, transplantation is the only answer. Nothing is going to bring back the follicle from the dead. So you're planting that garden outside. Sometimes you need a little fertilizer, but a lot of the time, if you've got to get some seeds in the ground, and that's where hair transplants come into play. So we're taking the permanent follicles that are immune or relatively resistant to DHT and other things from the back and the sides of the scalp, no longer with a scalpel or stitches or staples in the back. We don't have to create a long linear scar. We can take the individual follicular units, which could be as small as a single follicle, but usually groups of twos and threes. Those are plucked literally microsurgically, individually, and then reimplanted into the thinning and the balding area. And the point is that the reason why you'd want that less invasive process is, first of all, no linear scars. You can wear a much shorter haircut. Also, quicker, less restricted, and less painful recovery. So like within 4 days, you're back in the gym. You could be sweating and so forth, resuming sauna and steam and things like that in a short period of time. The crusting flakes off after a week, and you're basically back to normal at full tilt exercise regimen. But the unique angle, orientation, and position of those hairs is controlled by the surgeon, meaning that when I make the recipient sites where the grafts are going to be placed into the scalp, that's done manually. I'm making those recipient sites by hand, and that determines how the hairs are going to grow. And it's really important because hair doesn't grow like this. It doesn't grow perpendicular from the scalp. Nowhere on your body does hair grow perpendicular. It always grows at an angle and different from the hair next to it. And that's the truth on the scalp, no matter where you are. Hair on the sides grows in one direction. Hair on the top is a swirl. Hair in the front usually has an angle to one side or the other. Sometimes there's a cowlick even in the front. And the temporal points on the side aim downward. They don't aim upward. So these are important nuances. If you're going to get a hair transplant, not only do you want someone who's using the latest and greatest technology, but also has an artistic eye. And so, I've been blessed to have been performing hair transplants since 1998, 1997, and doing over 14,000 procedures. And one of the things that I pride myself on is that if I do doing it well means doing it in a way so that nobody can tell that it's a hair transplant.
And approximately how much do these procedures cost? And do most people just do one?
Yeah. So if depends on the size of the area of hair loss. Like my dad, for example, he had total baldness from frontal hairline all the way through to the crown, obviously sparing those androgen insensitive follicles around the sides and the back. And so he needed about almost close to 10,000 grafts to fill up his whole scalp with hair. And so that's a pretty heroic restoration. And years ago, it required multiple sessions, to get the job. I think he had 4 sessions to get all the work done. Today, it's going to be a fewer number of sessions, but still the same numbers of follicles and grafts need to be moved around. So look, an eyebrow or a sideburn scar is going to be a less expensive procedure than a total restoration. So hair transplants could range anywhere from $10,000 to $50,000 here in a clinic like mine, for example. And that's without any of the regenerative treatments or healing accelerator things that we do. But remember, transplantation is a science and an art. And certainly, I'm sure we're going to get all kinds of messages. I can get it done in Turkey for XYZ dollars. But the unfortunate thing is that we don't know what's happening over there. There's very, very little regulations. There's reports of injuries and deaths that are coming out of that area of the world. And you can search it up. You don't need me to tell you all the risks of medical tourism. I think the women learned it faster. They realized that when they went to alternate countries to go get BBL or liposuction procedures, and they came back with raging infections and didn't want to be seen by their traditional doctors here in the States, they realized that this maybe was not such a smart idea. And a hair transplant is very difficult to reverse. So you don't want to make some kind of weird decision like a straight across hairline. And You can see it every single day on social media. The hairlines are straight across coming back from overseas. It's a very unusual and weird look. It's not natural to have that. So good hair transplant is not cheap, and a cheap hair transplant is not good.
And post-transplantation, do people still need to do minoxidil finasteride, or is it that those hairs that are transplanted are not likely to be as sensitive to DHT, and generally they don't need to do a lot after a procedure?
Transplanted hair, remember, is relatively permanent, but your other hair is not. So it's critical. This is like the most important critical take home message of the entire interview, that you have to be on other medical modalities or other treatments to protect your other hair in order to minimize the amount of transplants that you're going to need over the course of your life. You could potentially run out of available donor hair. That's not a good plan. We don't have hair cloning yet, although we can bank your follicles and be ready for cloning in another decade or so, but that technology doesn't exist. So you have to protect the existing hair, get that fertilizer in the ground so that the existing plants are doing well, and then reseed those areas that have receded, right? You understand? See what I did there? You could put hair follicles, you put follicles into the area where you're thinning or balding to recreate the hairline so that it looks amazing. But you have to protect the other hairs. So what is that going to be? Is it going to be ongoing medical therapy daily? Is it laser light every night? Is it PRP once a year? You'll figure that out. And that is always part of the plan. In fact, if you come into my office and you say, I just want a hair transplant and I don't want to be on medical therapy, guess what? We're not going to be operating on you. So that's a fool's journey, unfortunately.
I'm going to combine several questions in this last section because I know we're running out of time, and then I'll ask you my final question. But I wanted to get your thoughts on supplements. So this will be a little bit long, but then you can just give me the highlights of what stands out. So biotin, common supplement that we know can help hair growth. More recently, there's the Lustreva type of biotin, which is magnesium biotinate, that's said to be even better for hair growth. So wondering if you've seen differences with that, looking at things like silica, tocotrienols, wheat ceramides, things to increase stem cell production, anything in the nutraceutical supplement realm that really stands out or cuts the mustard for you for supporting hair growth?
Yeah. I mean, I think, everybody's kind of like born with this idea that biotin might be helpful, and there's a lot of pushback from the medical community because you don't have big pharma doing this massive clinical trial on biotin to see if it helps. And it's so cheap, right? Less than $1 a day, you could be on a very good quality 10,000 microgram biotin. In fact, we have biotin under the Bauman brand. So is it some miracle? No, of course not. Does it work? I think it definitely does. There's no question that patients come back after starting on a biotin, especially if they have thin, fine hair or hair quality that's changing. The first thing they tell me within about 6 to 12 weeks is their fingernails are growing stronger. So I know that there's a biologic effect. It's not a placebo. Look, men and women know how often and how they trim their fingernails. This is like something you do thousands and thousands of times over the course of your life, right? Trimming your fingernail. You know if it's growing stronger or thicker, or your nail clipper is worn out because your nails are so strong. And patients have told me this again and again. So, and then we measure the hair, right? So before you started on that nutritional, we did a measurement so you can come back. Is it some massive 200% improvement? No, but there is some improvement there. And we can also measure shine and other things to look at the health of the hair follicle and the cuticle of the hair, which is the coating on the hair. But the point is that I believe that these have an effect. Now, the special biotin you mentioned, I have to admit, I've never heard of it. So I'm going to look it up, and you're going to send me that information. I'm going to check it out. So you did stump the doc on one of them.
Nice.
So good job. I mean, it took you about 2 hours, Scott, but okay, I'll give you that one. I never heard that one. Some of the other stuff that we like, there's a product that we use to help release stem cells from the bone marrow. And this is a product that was designed by Dr. Royden down in Panama. And it's an interesting product. It's a fermented probiotic that we give to patients, and it actually increases the circulation, the concentration of circulating endothelial progenitor cells, these EPCs, which are little stem cells that come out of the bone marrow. And yeah, they're good for not just tissue regeneration repair, but more importantly, I would say new blood vessel formation. And if you think about what we're doing, planting literally thousands of follicles into the scalp, every single follicle needs a new connection to a blood vessel. So if you can send out EPCs, I don't know how many come out, thousands, millions, whatever, all at the same time, around the time of a hair transplant, I think that'd be kind of helpful. And so we have that underneath the Bauman brand, and we call that the recruiter, right? Because it's recruiting stem cells out of the bone marrow into the circulation. So I'm a big fan of that. Nutraceuticals, I would say over COVID, ashwagandha. What is ashwagandha? Ashwagandha stress adaptogens can help your body be more resilient to the effects of stress and cortisol. Cortisol, bad for hair, right? So mindfulness, meditation, exercise, sleep, ashwagandha too. So it can be helpful. And a lot of folks describe a calming effect. Some people don't necessarily notice the effect, but it seems to have a positive effect on mood as well for many patients.
Any comments on tocotrienols, wheat ceramides, or the very popular colostrum products these days?
Yeah, so I hear all the claims on the colostrum. Wheat ceramide I'm not so familiar with. So yeah, you stumped me on number two. And then, Armra, I guess, is probably the most popular, nationally known, advertised colostrum. I had a patient come in and swore by it, said that his hair improved dramatically. And, look, I saw the commercial too. So maybe, I don't know. I'm waiting to see a little bit more data. I've tried it myself. I find that sometimes I don't think that I don't respond very well to colostrum for some reason. Maybe it's just when I take it or how I haven't learned to do it correctly yet. But, for me, a little GI upset, not a big deal. And I have a stomach of steel, by the way. I just eat just about everything. So if something is upsetting my stomach, I usually would not continue on with that. But I'm willing to try it, and I wouldn't dissuade someone from using it. I think there is a lot of good science and data behind it. Not yet necessarily for hair, but who knows? I'm open-minded. Let's see what happens. I wouldn't put it in as a magical miracle yet. Let's see how it goes.
My last question is the same for every guest, and that's, what are some of the key things that you do on a daily basis in support of your own health?
Yeah, so I have to tell you that for many, many years, never a very good sleeper, right? So sleep, as we know, is critically important. And, back in the 1990s and even in the early days of my practice, a lot of the people that I followed didn't seem to prioritize sleep, and I guess whether these are business leaders or whatever, motivational speakers, sleep is for the weak and all that. Of course, as we know today, sleep is critical. Evolutionary conserve, like 8 hours, hopefully, and how that decreased with the Industrial Revolution and probably not much to our detriment. So I've always tried to improve my sleep, and I've done just about anything and everything. I'm almost 6 years on the Oura Ring, and I will tell you that the one thing that's really improved recently is the bed chiller that I had basically crapped out, and I had to get a new one. And so I tried a different version. I tried one of the newer devices that's AI powered just to give it a go. I honestly, it's only been 6 weeks and I still have the old one in a box that I had before because I'm so skeptical of new technology, just to make sure that it is not a lemon, that I have to send it back and then be without it. But I'll tell you that my readiness scores on the Oura Ring have been increasing every single week. And so for the past month and a half, you can see my scores. It goes like this for the past few months. And all of a sudden, readiness is going way up. So I think it's working. And I'm amazed, actually, how well it's improving my sleep scores. So I'm super excited about it. If somebody wants to contact me, find out which bed I'm using. It's very, very cool. And it works great.
That's the really nice thing about the Oura Ring. And I'm doing the same, testing some other technologies, and fairly recently have gotten to where very consistently I'm getting more than 2 hours and 30 minutes of deep sleep per night.
Get out of here.
Which never happened to me before. I mean, that was a rare, I slept okay.
All right,
but
Scott. No, you can't let me go without knowing your sleep stack then. What are you doing? No. We got to hear it. We got to hear it right now. Oh,
yeah,
man,
it's actually a wearable device that I learned about from a medical doctor. And again, nothing works for everybody. I don't want to oversell anything, but it's this little wearable thing called the AmmoFit. And it's essentially a small PEMF device that's supposed to stimulate the vagus nerve. And very similarly, my readiness, my sleep scores, my deep sleep all have really improved over the past few months with this. Not claiming it's going to work for everybody, but they have a policy. You can return it if it doesn't, all that. I think it's worth trying for people. I do like it.
I've tried everything, and so I can't wait to try it.
This has been such a great conversation. I really to be honest, was really shocked by how holistic your approach is, not just hair, but whole body. And so I really enjoyed this conversation more than I even anticipated. You were super generous with your time. And I really want to thank you for helping us get to the roots of hair loss. So thank you so much, Dr. Bauman.
It's my pleasure, Scott. Thank you for having me on.
To learn more about today's guest, visit BaumanMedical.com. That's Bauman, Bauman, medical.com. BaumanMedical.com. Thanks so much for listening to today's episode. If you're enjoying the podcast, please leave a positive rating or review, as doing so will help the show reach a broader audience. To support the show, visit betterhealthguy.com/donate. To get my newsletter, visit betterhealthguy.com/newsletters. To follow me on Facebook, Instagram, X, or TikTok, you can find me there as Better Health Guy. This and other episodes can be found on Apple Podcasts, Spotify, Amazon Music, YouTube, and Odyssey.
Thanks for listening to this Better Health Guy blogcast with Scott, your Better Health Guy. To check out additional shows and learn more about Scott's personal journey to better health, please visit betterhealthguy.com.